What are the symptoms, the signs and symptoms somebody will see before he can be thinking this may be prostate cancer?
Thank you, Dr. Israel. Nice to have you. So number one is that you must realize that the patients can be asymptomatic. It means that they can have prostate cancer without knowing. Ideally, this is the type of patient that you want to see. Somebody who just walks into the clinic, a 50 or 43, 46-year-old man, just wants to have screening. Oh, doctor, I'm coming here for my annual screening for prostate cancer. You talk to him, no symptoms. You run his blood check, his PSA check, you examine his prostate, and ultrasound if need be. So patients can be asymptomatic. We must bear that in mind. Then patients could have what we call local symptoms. That means symptoms that are related to the prostate. Prostate cancer can cause the prostate to enlarge. So this can cause some form of obstruction to the flow of urine. So the man can have difficulty with passing urine. He may have to strain before urine comes out. When it comes out, the stream may be poor. He may see some blood in his urine. He may have to wake up many times to pee at night. And even during the day, within a short time, he wants to pee again and he wants to pee again. Sometimes he can't hold urine. If he doesn't go to pass urine, he may pee on his body. These are lower urinary tract symptoms, which can be a signal that there may be prostate cancer. They can have what we call local evidence of local advancement. This is the prostate cancer is spreading to structures that are around it. During ejaculation, there may be blood in the ejaculate. We call that hematospermia. You may begin to have things like constipation because the prostate is just in front of where the rectum is. So it can begin to obstruct, feces and things like that. You may have symptoms related to what we call metastasis when the prostate cancer spreads to the common places it likes to spread. The commonest place it goes to is the lower back, the lumbar, and the sacral vertebrae. Low back pains, bone pains, set on the long bones like the arm, the legs. The low back pain can begin to affect the nerves that emanate from the spinal cord. And it can also cause the vertebrae to collapse on each other and compress the spinal cord. So you can have weakness of the legs, inability to walk, inability to control urine and feces, etc. We have seen in our study, if you look online on unusual presentation of prostate cancer, you see a study that I performed along with my teachers where we looked at the unusual ways that they can also present with lumps on the head, on the bones and things like that. But I mean, it's good to know the most common things, like the things that we've discussed now. So these are the ways that patients can present with prostate cancer.